The legacy of Dr. Robert Warner is that he took care of the kids, and he said, I'm going to take care of them. And it's not just I'm going to take care of them. I'm going to take care of the whole family, and I'm going to make sure that they're taken care of. Where we've really gone with healthcare is that we have a lot of really incredible people. We have a lot of very, very specialized healthcare. They do really, really incredible things. But what Dr. Warner did is that he gave them a home, right? He gave them a home where families would come and say, I'm going to make sure all my needs are taken care of. And it was not just, okay, I'm going to make sure that I'm going to have this medical issue taken care of. It's, we're going to take care of families, right? We're going to take care of all your needs. We're going to make sure you know how to take care of your child at home. We're going to make sure that you know how to take care of your needs with your families as well. And this is your home. This is, we have a concept. It's called the medical home. And it's really a concept that it's a place where all of your needs, and that includes your caregiver needs, your family needs, just to make sure that all of your needs, your holistic needs, that's taken care of. And that's a legacy that Dr. Robert Warner left. And I've heard this time and time again from so many people. And this is the legacy that I want to be able to continue. I mean, it's what I firmly believe. It's really about supporting the entire family and the community. It's not just about, a prescription that you prescribe or a therapy you prescribe. It's about the whole picture. We have a newborn neonatal follow-up program. That is a program where we follow both the health and wellness of children who are discharged from the neonatal ICU. Many of these children were born premature. They need very close developmental follow-up. A number of them have medical needs that we can help with their primary care physician in managing things like feeds and their breathing, because a lot of children who are born prematurely have, they have some lung disease that needs to be managed. So that's one. We have an incredible autism service. Dr. Michelle Hartley-McAndrew does an incredible job of not just with intake and diagnosing, but also working with families to make sure that our children with autism get the very best services. We have a Developmental Clinic with some new folks like Dr. Ted Andrews, who have really come in and just elevated the developmental, not just the screening, but also the follow-up and the follow-through that we have. For children, particularly children who have special needs and disabilities, who may also have coexisting behavioral concerns and disorders. And we're now really just following these kids, not just for diagnosis, but for follow-through. We have a group of physicians, Dr. Melissa Zula, Dr. Diana Marchese, who are physical medicine rehabilitation. So, they really specialize in the function of children with physical disabilities. Their wellness really work with a therapist to prescribe and manage motor, cerebral palsy, spasticity, just to make sure that kids have an excellent quality of life. And we also have a robust feeding program where we work in consultation with our speech and language therapist to make sure that children with feeding disorders are able to grow and feed safely. We have so many people that we work with. I can't possibly go through the entire team in such a short period of time. So I would shout out to all the folks that I wasn't able to name, but we have an incredible team of folks. Yeah, no, this is a really special place. I mean, to see a community rally around its kids and the hospital is incredible. And that's why I'm here. I came here to be part of a community that really values its kids.